Importance of clinical correlations, why tests alone are not enough. What if the most advanced medical test in the world still couldn't tell you what's really wrong? In an era of cutting-edge technology, MRIs, CT scans, blood panels, you might assume diagnosis is now purely scientific, precise, and foolproof. But here's the surprising truth. Tests don't diagnose patients. Doctors do. So what bridges the gap between data and healing? That bridge is called clinical correlation, and it may be the most overlooked yet vital skill in modern medicine. Power and limits of modern diagnostics. Modern medicine has revolutionized healthcare through advanced tools, blood, urine, and stool tests, imaging like X-rays, CT scans, MRI, and PET scans. These technologies can detect disease with incredible precision, but here's the catch. They only provide fragments of the story. A scan might show an abnormality. A blood test might show elevated levels, but neither explains why, how, or what it means for this specific patient. 2. What is clinical correlation? Clinical correlation is the physician's ability to combine test results, understand patient history, observe symptoms, factor in lifestyle, psychology, and environment, and then synthesize all of this into a meaningful diagnosis. It's not just analysis, it's interpretation. This is where medicine transforms from data processing into decision-making. 3. The hidden challenge, too many possibilities. A doctor often faces multiple possible diagnoses, but here's the dilemma. It's impossible and impractical to test for everything. So doctors must prioritize possibilities, make judgment calls, decide what matters most right now. This uncertainty is not a flaw, it's the reality of medicine, and navigating it requires experience, reasoning, and sometimes intuition. 4. Healing isn't always high-tech. Not every cure comes from a machine or a complex procedure. Sometimes healing begins with a reassuring conversation, careful observation, a simple lifestyle change, a basic medication. What works for one patient may not work for another, even with the same condition. This reminds us, medicine is not one size fits all. 5. The dynamic nature of patients and doctors. Every patient is constantly changing, physically, emotionally, environmentally. Even the same patient can present differently on different days. And doctors too evolve with experience, context, understanding. Every clinical interaction is unique, never repeated exactly the same way. Recognizing this fluidity is essential for accurate diagnosis and effective care. 6. A deeper insight, nothing is fixed. This idea connects to a profound philosophical perspective found in entity philosophy, Mahayana Buddhism. Mahayana Buddhism and changing essence, not even disease. For medicine, this means no condition is entirely fixed. No treatment is universally absolute. No patient can be reduced to a label. This perspective encourages humility, adaptability, holistic thinking. 7. Clinical correlation, the art of medicine. At its core, clinical correlation is not just science, it is an art. It blends scientific knowledge, clinical experience, human intuition, awareness of complexity. It is where medicine becomes deeply human. In a world driven by data and technology, it's easy to believe that machines hold all the answers. But the truth is, healing happens not just through tests, but through understanding. Clinical correlation reminds us that patients are more than reports. Diagnosis is more than data. Medicine is more than technology. It is a thoughtful, dynamic, and deeply human process. The best outcomes come when science meets wisdom and data meets understanding. If this video gave you a new perspective on medicine and healing, share it with someone who might benefit from it, because sometimes the most valuable insights are the ones we pass on. See you in the next video.